So we've just finished a kind of historic milestone. We finished the last of our lifestyle-related pooling project studies. We published in the last couple of years on alcohol and cigarette smoking, and most recently on body size and risk of multiple myeloma in the pooled studies within InterLymph who have myeloma cases. And we found that alcohol seems to have an inverse association with myeloma risk. It was not a strong, striking association, but very a modest inverse association seems to be what the data suggests. But for cigarette smoking, we didn't see any clear evidence of an association. For our obesity study, we found that both younger and usual adult body size are positively associated. So people who are heavier, even in young adulthood, have an increased risk of multiple myeloma. And when we looked at the two variables together, the highest risk of myeloma were in people who had been heavy both in younger adulthood and more recently in later adulthood. And so we're pleased to be able to reinforce a public health message that maintaining a healthy weight throughout life may confer an extra benefit of reducing a risk of multiple myeloma. So we're really pleased that those studies are out now, and along with the study of reproductive risk factors and some occupational work has been done, and the reproductive study didn't see any associations for both parity or medication related to oral contraception or postmenopausal hormone use. There was maybe a suggested inverse association for postmenopausal hormone use, but it wasn't consistent across all the studies that were contributing data, so we're not sure that it's a reliable finding. So right now, there's a study that's in the works, a pooled study of occupational solvent exposure, and Anna Claire DeRoos is leading that, and that will hopefully be coming out in the next several months. And then we have a lot of action going on in the area of genetic susceptibility. There are some investigators who've already been doing GWAS of multiple myeloma as collaborators, and they've published and replicated some of the early GWAS publication findings. And they are also looking at genetics of survival of multiple myeloma. That's being led by Elad Ziv and Nikki Camp from Utah as part of that group, and Celine Vachon at the Mayo Clinic. And also the group is gearing up to gather samples to join the next round of the larger GWAS that InterLymph has been working on for a long time now. So we'll be contributing samples and looking at a fresh GWAS across a much larger pooled study sample to see if we can identify genetic predictors of myeloma risk. And some of those are family studies, so the people who have myeloma families and are looking at heritability will be able to inform the group that's just looking at sporadic myeloma and hopefully reproduce one another's findings as well. So.